Welcome, everybody, to Plastic Surgery T&A. I am Earl Stephenson Jr., your Atlanta board certified plastic surgeon. Thank you for joining. If you're a first time viewer, we really welcome you and hope that you stick around for this episode and decide to subscribe and like, and of course, always share. If you are a return viewer, thank you so much. I really appreciate your support. It really helps the channel really grow and spread because what I'm about is truth and transformation, as you know. So, on that note, we're going to talk about transformation. We're going to talk about social media. When I started in this business, the way to advertise and the way to really get yourself out there was to get in the yellow pages and go and shake hands and kiss babies. That was the dinosaur age. And now we're in the age of social media where it influences basically our thinking and our actions. And so plastic surgery is no different. So plastic surgery trends used to be, again, kind of back in the day, set by celebrities. Celebrities would come on the red carpet wherever they were or in the movies, and people would try to emulate their look. Now that's changed, that's shifted. TikTok, Instagram, heck, YouTube, Facebook influencers have really changed the game and really shaped the industry of plastic surgery as far as cultural trends, surgical trends, what have you. And I'm asking is this a good thing? What do you guys think? I mean, have you ever seen a procedure online and said, I think I want to do that? If you have, I love you for you to drop a comment below and we can chop that up either in this episode or future episodes. Key facts that tell you that influencers are what they are, influencers. Did you know 70% of Gen Z patients were influenced by social media to have a procedure? 70%. That's a lot. That is really a lot. And it's tend to lend itself to people focusing on things that they one never thought about and somewhat maybe minor. There is a entity called BDD, called body dysmorphic dysphoria. Social media has a little bit of an offshoot from that, and it was termed initially Snapchat dysphoria, where people kind of have looked at themselves on these platforms holding their phone and go, oh my God, I look terrible. I need to have my eyes done, my eyebrows arched, my nose thin, my lips fuller, my cheeks gaunt, my chin more prominent, whatever. So I'm going to call it social media dysphoria. It really has, taken plastic surgery to a new level. And I don't think that is all good all the time. So I want to talk about a couple of trends. I want to talk about trap talks, and we'll get into each one of these individually. I want to talk about the snatched nose. I want to talk about buccal fat pad removal. I want to talk about the Whoville Nose Job. That's a new one on me, and that's going to be real interesting to get your feedback on that. And then we finally want to round that out with talking about the fox eye surgery. So, not necessarily in that order, but we're going to talk about each of these things, and I'm going to give you kind of what they are, what the upsides are, if I think they're really legitimate, what the downsides are, and answer any questions again that you may have. So, on that note, let's talk about trap talks. So, let's bring up our little slides. Let's see, I've got to find, I'm my own producer. So, bear with me. So, trap talks. So, what is trap talks? So trap talks is basically using Botox, believe it or not. Botox initially was FDA approved for the forehead, glabella, which is between the eyebrows, and crow's feet. Now Botox is used in various areas, kind of off label in the lip or corner of the mouth for a lip flip, kind of here in the neck to kind of take care of bands in the muscle. If people have like clenching type problems and have a wide face or want to really narrow that muscle, but people are using it, and mostly women, in their shoulders. Now, that's not new, but they're using it in their shoulders cosmetically. That is new, and that's called trap talks. And what's the reason for that? Women want to have a really elongated neck, a really nice, as we call, swan neck. As you can see illustrated here, this lady's got really narrow shoulders, doesn't have a lot of bulk on her arms or her shoulders because she's thin anyway, but she has this really long, elegant neck. And so, sometimes our ladies aren't born like that and they want to try to achieve that. So, how do they do that? They do that by having Botox injected into the shoulder muscles. Now, again, this is not new. This is new cosmetically, but it is not new medically. People who suffer from migraines uh, benefit from this treatment significantly, and that's been implemented for the last 2 decades, where Botox has been used in the shoulders, the neck, the jaw, the face to alleviate tension for migraine sufferers. Also, people who have dystonia, which is a kind of a tightening or uh, movement issues of the shoulder, it can be used medically for that. So, again, not a new concept, just a new twist on it called trap talks for cosmetic reasons. So if a client comes in and they have, more bulk on their shoulders than they desire or that she desires, then Botox can be given in those areas. And here's a kind of a semi or a imposition of a before and after. As you can see, before the shoulders look a little bulky. I hate to use this term like a linebacker. Over time, using Botox in these areas can weaken the muscle, and that weakened muscle becomes thinner. So it gives you less bulk and gives you the illusion or the absolute elongation of your neck because the shoulder doesn't come up so high on the neck. So trap talks actually is a thing. Is it good? It depends on the practitioner, depends on their experience. It's not without issue for sure, because you want to make sure that your practitioner understands the anatomy of the shoulder, anatomy of the nerves and muscles in that area, and doesn't place Botox in an area that would greatly weaken the shoulder or at a dose that is unusual that will weaken the shoulder and cause you functional issues. You want to look nice and have a elongated neck, but you still want to be able to use your shoulder. So it is not something that is available in every office. And so you've got to pick and choose wisely. It can be done by a board certified plastic surgeon. I think that's the best person to do it. I'm biased. And the reason I'm biased is because as surgeons and as plastic surgeons specifically, we operate on all areas of the body. We have to know our anatomy from literally head to toe. Dermatologists inject Botox, which is fine. They may inject your trap tox. They've never really operated on the shoulder. I have for all kinds of things. Somebody got in a car wreck and tore the skin off their shoulder. Somebody has a breast reconstruction. I need to use one of the muscles in the back that attaches to the shoulder blade and upper arm. I'm used to that. I know what that looks like inside, which is the most important, and out. So I know the anatomy, the circulation, the configuration. Not that I would use that or need that in Botox, but if something goes wrong, then I know what went wrong. And most importantly, an ounce of prevention is worth a pound of cure. I know where to inject and I know how much to inject. So, trap talks is a thing. Really kind of TikTok, I think, really picked that up and moved that along. And I think if you do it over time, it could have some benefit. Just be very, very cautious of who you have it, who performs it, and make sure that they are really experienced. So, trap talks is one. So, the next trend I want to talk about is the snatched nose. Now, we've talked about the snatched waist, we talked about snatched, I don't know, everything, but really the snatched waist is really where this word came from, where you kind of got this really thin waist. And that can be from a tummy tuck or lipo, or even heaven forbid, you can have a couple of ribs removed and really snatch your waist. So you have nice hips, nice chest or breasts, and you really have that Coca-Cola bottle shape. But people are snatching noses now. So what's that mean? Typically, this is a non-surgical procedure. A snatch nose is where you use fillers, hyaluronic acid fillers, and they come in the form, of Juvederm or Restylane. Those are the, product names. So generic name is hyaluronic acid, and you can use this substance just like you use fillers anywhere else for the under eye, for the cheek, for the folds. You use this filler in the nose to build up the tip, soften a hump, really kind of give you features mainly of the dorsum or the bridge of your nose and tip to make it look thinner. The more that you can build this middle part up and tip up, the more it looks narrow because light hits it in a different manner. Again, just like anything else, you got to go to somebody who knows what they are doing. And in this particular case, for sure. And that's why I like surgeons, plastic surgeons doing this. Again, you can have your dermatologist do this. You can have, for heaven's sakes, a primary care physician who's a cosmetic, uh, aesthetic medicine dog do this, but they're not surgeons. Again, I've operated on nose. I long have given up doing rhinoplasty or nose jobs, but I still do nasal reconstruction for people who have ripped their nose off, or they're, unfortunately in the summer, a dog's bitten off their nose, or for heaven's sakes, and really most often, they've had a skin cancer or a cancer in their nose and that's been removed and they need to rebuild their nose. I do that all the time because I enjoy that. So I understand that anatomy, really intimately. So if I chose to, and I've done this once or twice, not to the extent that I'm going to show you here, but to fill small defects, I've used filler to kind of mask that. It saves us from an operation. It is temporary. The filler lasts about a year plus, depending on what filler you use. But I've used that. But to use it to build up in place of a rhinoplasty, you've got to be cautious. So let's talk a little bit more about a snatched nose. So I'm going to show you a before and after. It is not mine. It is from the Aesthetic House, I believe, of Dallas or Houston. I can't really see that, but I borrowed this from Instagram. So here is a before at the top. As you can see, her nose has a hump. The tip is a little droopy. It's a little it's not very refined. After using filler, they've given her a more refined tip, and you don't really see the hump. So how do they do that? In my opinion, they use filler to fill just above the hump to make that level, just below the hump to make that level, and fill just the tip beyond the level of the bridge to give it a little bit of a point. Again, not unreasonable, but you got to be careful for a couple of reasons. There's only so much filler that skin can hold. That skin is tight, so you can't just pump filler in to make the nose what you want it to want it to be, because the nose is a little bit unforgiving. It's just not going to fill up like a empty sock. You can only put so much filler in. And if you put too much filler in, you may actually put too much pressure on the skin of the nose and cause a problem. But the most likely problem is that you may inject filler into the blood vessels that feed the nose for health. And that is a problem. So let's talk a little bit about the anatomy or vascular anatomy of the nose. And it's just easy just to show it. The face is really great about having good blood supply, so great healing capacity, but it still can be injured. As you can see, just on this patient's illustrated left side, you see a blood vessel running up from the corner of the mouth to the corner of the nose. You see a blood vessel running down, or a group of blood vessels running down from the eyebrow, and kind of one from around the outside of the eye. These all feed the nose. And if you're unfamiliar with the anatomy and have a technique that uses sharp needles, that sounds stupid. You can use blunt needles called cannulas, but using sharp needles, you can easily puncture one of these arteries and put filler into the artery. So you're like, well, what's the big deal? The filler acts like a little concrete wall and shuts off the circulation to the area. Now the face is great because it has that same anatomy more or less on the other side, which then kind of comes and fills that side, but it also contributes to the opposite side. So you sometimes you can even have that happen, and the body is so sophisticated, it's got a fail safe because the other side kind of helps keep the circulation alive and nothing bad happens. But occasionally something bad does happen. And if you're going to go again to somebody who's going to give you a snatch nose, and again, I think this is if you want a snatch nose, you're asking for an operation. You're asking filler to do too much. But if you're going to go to somebody who does that and does that well, then great. But if you go to somebody and you're not sure they do that well, you can end up in trouble because one of these arteries can be blocked. And when one of those arteries is blocked, then the skin that depends on that nourishment could die. And this is what that looks like. Got this from Instagram too. She looks fine on the left. She had a filler for her nose and lips, and it shut off the circulation to basically the tip of her nose. And that tissue that's brown and dark brown and black is unhealthy dead tissue. And that tissue is going to need to be either removed or it's going to fall off naturally and it's going to leave a big defect. And now she needs a nasal reconstruction, which is a whole nother issue. Again, I do that all the time where we take forehead skin and move it down. And it's a journey. It is a journey to get a nose that's reasonable. So you got to be able to recognize when this is a problem. So, you got to make sure that your surgeon, your injector knows the signs. Area's a little flushed, area looks a little bruised, area looks a little red, area looks, maybe like the skin is a little unhealthy or blanched or white. If that's the case and that's recognized immediately, then there's something that needs to be done, and there are protocols to inject filler dissolver to keep the area warm so that the circulation can be robust and help kind of minimize the damage that can occur because the circulation has been shut off in one area, and you've got to wait this out. You can't really reverse it totally. There probably is going to be some damage, and you got to let that kind of play out. And then once it's done, then you may end up with a scar. So this is a second case to illustrate that. Look at this. Look at that skin. That skin's got a little slough, that yellowish stuff. It's got some, frankly, dead tissue or dying tissue, that purple tissue. And you can inject dissolver, you can warm the area, you can send the patient to get hyperbaric oxygen like Michael Jackson, and those things are helpful, but it's not going to reverse it like nothing ever happened. And you're going to end up with something like this on the right. And this was a lovely young woman before. Again, choose wisely. You want a snatch nose and you don't want to have surgery, you run the risk of this. Surgery has its own risk, but surgery can certainly produce a snatched nose more readily than filler. because you may be asking filler to do too much and you may be injecting in the areas that you really shouldn't inject it. And filler in the nose is not FDA approved. So there you have it. So that's the snatched nose. So be careful about the snatched nose. And I got still got trap talks on here, but we've been talking about the snatched nose. So that's what we're talking about now. And then we're going to shift gears to our next social media trend I want to touch on briefly. We're going to talk about the fox eye. Now, the fox eye is really interesting because women use makeup to create a cat eye. Now, I'm no makeup artist, clearly, but they use, and ladies chime in below if I'm using the wrong terms, but they use eyeliner and makeup to kind of create an uplift of the eye. You see ladies with this little extension out here, and it kind of gives them a seductive eye that has a little bit more of a slant to it. And that's well and good. That's all good. Some people want to take it further. Some women want to take it further. They don't want to apply the makeup. They want to look like that every day, all day, as the people would say. And you can do that by physically moving the eye up and giving it that slant. And it can be done surgically through blepharoplasty, which is a lower eyelid lift, which often can tighten the skin. But in conjunction with that blepharoplasty, you can do what we call the $1 million word, a canthoplasty, which is taking the corner of the eye and really kind of detaching it where it naturally sits and then reattaching it at a much higher level. And that's a surgical procedure that's pretty much permanent. And once you do that, once you go down that road, you can't go backwards. You can try, but if you do, you'll never get to where you were before surgery and it looked natural. So you can do it that way, but there's some non-surgical ways to do it. And I think this is where social media really picks up on. You don't have to go to sleep, you don't have to have a recovery. You can use PDO threads, and I've done a podcast about those, and I don't really like those, but you can do a PDO thread, which basically uses a fishing line that's a stitch to come in and capture that corner and lift it up. And hopefully your practitioner is good and lifts both at the same height. They don't have one that's down and one that's up and don't have any puckering. But if they do, unlike the surgical remedies, blepharoplasty and canthoplasty, PDO threads at least are temporary. They do dissolve. And you can do things to minimize that. So you can definitely do that, or you can use filler if somebody's really good and really savvy with filler to kind of fill the brow area to kind of give it a little bit of a lift to kind of help give that fox eye or cat eye illusion like you see here. So again, I think this is overstated. This looks crazy to me. I mean, that's what it looks. It looks crazy, but it can be done. And this is something I say all the time. Just because it can be done doesn't mean it should be done. Ladies, stick to the makeup and just do the cat eye. Because again, if you have it done surgically, you the cat's out of the bag, so to speak. You can't go backwards. So that's one. If you do it non-surgically, it may get better with time and probably will resolve. But again, it's no guarantee it'll go right back to where it was before. And the last thing, when you alter this, you set yourself up for so many issues that you're not aware of. You expose more of the corner of the eye, which can dry out, cause redness, cause tearing. In the worst case scenario, it can cause like ulcers of your white of your eyeball. If you slant it too crazily, tears need to run down toward the center of your nose so they can drain in your nose so you can have a snotty nose and an ugly cry. If you change that inclination one way or the other, then tears don't run, and you got tears running down your eye, which don't naturally lubricate and naturally drain, which causes dryness and redness and all the things that I just mentioned, ulceration, even possibly, which could threaten your eye. So again, if you want a fox eye, get you a good makeup palette, good eyelid palette if that's a thing, and just do it that way. It's just easier. So that is the fox eye. Now, I ran into this one. This one was crazy to me. I just never heard of this one. Now, we all have, as children, especially somebody old like me, during Christmas time, watch How the Grinch Stole Christmas. It's a classic. Everybody's seen it for sure. Even if you're young, you've seen it. And the Grinch is terrorizing Whoville, Cindy Lou Who, and all the folks. If you notice in Whoville, everybody has this little button nose that looks pointed, up a bit. And lo and behold, on TikTok, there is a trend where people are altering their nose to look like people in Whoville. I mean, I had nothing to say about it. I never had heard of this, and it's called the Whoville Nose. Here it is on TikTok, the viral trend to avoid. I agree. The Whoville Nose. And I guess maybe filters have kind of helped amplify this. Here's a lady with a filter. She's just playing around with a filter. No harm, no foul. But there are people actually traveling to the country of Turkey, and their doctors actually performing this surgery. Now, if you live in the if you live in the geographic area near Turkey, or you're in Turkey and you want to have it done, I still think it's a bad idea, but you're at least there. If you are traveling to the United States and you want a Whoville nose and you're going to travel to Turkey, why would you do that? One, you shouldn't do it at all. And two, you shouldn't travel all the way from Turkey to the United States. You can find somebody, I'm being theoretical, you can find someone in the United States to do this. Now, being practical and realistic, no board certified plastic surgeon in his or her right mind would ever offer you that. But there's no need to travel to Turkey, for heaven's sakes, and there's no need to have it done. But nonetheless, people are traveling or having it done in Turkey. Here's a guy who has he has a he has a nose, he has a snodge on him, and he got that thing flipped up like Cindy Lou Who. Again, can this be fixed? Sure, it can be fixed. The nose can be, quote, re-lengthened to a bit, but it requires quite extensive surgery in the form of a rhinoplasty or nose job. And I think a lot of people, bouncing a bit, travel to Turkey for these unusual procedures because they're offered, and maybe they're offered, and maybe not as much as they would cost if someone were to do it in the United States. But if you hate this and you have a Cindy Lou Who nose at 72 and you hate it, you got two choices: to keep it or to fix it. And if you fix it, it's going to cost you a grip. I mean, because it's fairly extensive to lengthen the nose and get it to a point where it looks like it fits your face and it's balanced. So my point is, just don't do it. Whether you live in Turkey or where you live in Tennessee, just don't do it. It is not worth it. It's cute when it's a filter, but when it's a surgery, then you have crossed a line or you've rung a bell. Better yet, you've rung a bell that you can't unring. So, no to the Whoville nose. Do not do it. No. All right. So we talked about trap talks. We've talked about the snatch nose. We talked about the fox eye. We talked about the Whoville nose. Last but not least, we're going to talk about buccal fat pad removal. Now, again, this is, to me, not super new, super controversial, a social media trend that's trending. I used to be an oral surgeon, so I used to fix jaws, move jaws around for genetic abnormalities. I used to take out wisdom teeth, and we would encounter the buccal fat pad all the time, just in our routine surgery. It was more of a nuisance than a treatment. So I'm very familiar with it and its anatomy. Plastic surgeons have latched onto that many, many, many years ago as a procedure to shape the face, so to speak, to help you get a little bit of gauntness in your face. And so they use this procedure, and it can be a quick procedure that's done in the office. It can even be done in a local or sedation, but typically, knocked over my mic, typically it's done really in conjunction with other surgeries, such as a facelift. It's not a standalone procedure that gives you a big bang, in my opinion. If you're having a facelift and you're repositioning the muscles and giving yourself a youthful look and cleaning up the jaw, and you just want to have a little highlight of anatomy here, then yes, maybe you tease out a little buccal fat to help the overall result. But people are going in and just having it done, hoping to kind of get this look. It's not going to probably give you that. You if you want that, then you're gonna have to make your cheekbones a little higher and maybe like your chin a little bit prominent so you have more of an oval face, more of a strong uh, bone structure above, which makes this like a little more hollow. You take the fat out, which makes it that much more hollow, and you've got a strong foundation as a chin. So again, just taking out buccal fat in and of itself probably doesn't do anything, but here's kind of what it's supposed to do as a standalone procedure. To our left is before or normal. I mean, not bad. High cheek, good cheekbone, good structure of the angle of the jaw coming down to the chin. But taking out the buccal fat as it's presented on the right side of this picture gives you that little hollow. Does it really? Does it really? Probably not to that degree. Again, can it give you that hollow if you take a little out, you add a little something to the cheek, or you reposition the face so that the fat and muscle and skin that's descended down, it gives you this fold that I push it on. Does that help? Yes, that helps. You resuspend that tissue and gives you fullness to your cheek. You take a little bit out here, it gives you that that concavity or that shadow. Sure. But again, by itself, a buccal fat pad removal, again, probably not. So don't believe the hype there. You know, buccal fat is not without its issues. It can be a problem because it can have complications. Here's a picture of a normal buccal fat pad removal inside the mouth. That's a bonus. There's no scar on the outside of your face, but inside your mouth. But you got to know your anatomy. You've got to know where that fat is. That fat is close to the opening of a duct. And a duct is like a little tube that has kind of a little spout at the end, like your water, like your water hose. And it squirts out saliva to keep things healthy in your mouth. That's from the parotid gland, a pretty big gland here. And if you don't know where that is or know the anatomy of it, you can easily injure that. And that's a problem. Within that fat, there's a branch of the facial nerve that has five branches, and that nerve sits kind of like on your face like this. This branch right here travels through the buccal fat. And if you injure that, when you smile, you'll kind of have this kind of thing going. Not so much here, but you won't be able to really elevate that upper lip. So again, your surgeon needs to know that, understand that, and help you weigh the risk of that. Because again, in my opinion, this is a long climb, surgery, for a very short slide, minimal result afterwards. So you got to balance. Do I want to risk having a minimal result and possible nerve injury and possible injury to the duct? You got to ask yourself that question. Is it likely to happen? Probably not. But can it happen? It surely can. So, not a new procedure. I'm very familiar with it as an oral surgeon. In my previous life, it just kind of follows me in my current life as a plastic surgeon. So, again, not new to me. And I'm very comfortable with it. And on that note, I don't even do it that much. So it's not something that I think should be surgery that has a lot of clients that are having it done year after year. Because I just don't think it offers that much. It can be done kind of as a secondary procedure to kind of help augment a big procedure to make it look a little better. So, those are the procedures that social media has driven over the last couple of years. I think Trap Talks is reasonable in reasonable hands. I don't think you can expect to really elongate your neck so that you somehow go from here to here, but it certainly can reduce some of the bulk with repeated treatments. If you suffer from migraines or chronic stress or in your shoulders, it may help that as well. I think the snatched nose is just a bad idea all around. I think you should just get a rhinoplasty from a facial plastic surgeon slash ENT surgeon or a plastic surgeon. I think having a fox eye is a bad idea. Just makeup. That's the answer there. I think a Whoville nose is an awful idea. There's no solution. Just don't do it. Other than get on your favorite platform and put a filter on and have some fun. Buccal fat pad, you can do it. Not doesn't move the needle in and of itself, but it can help another procedure that you're having done, such as a facelift. So there you have it. That's my take on social media. Is it harmful? It can be. Is it helpful? Maybe. It certainly is influencing, and influencers are using it to drive business. And people who are not adequately trained, who are hitching a ride, will jump on this and offer you these things, and they have no clue as to the anatomy, the techniques, whether this is a good surgery with reasonable results or the outcomes, and they certainly don't know how to take care of the complications if they decide to do something like this. So always, always, always seek out the opinion of a board certified plastic surgeon. Yes, it may cost you a consultation fee, but that's a drop in the bucket versus having a disaster where you've taken out too much buccal fat, for instance, and you've got this real gaunt look, and you can't readily fix that. You can't take that back to where it was before and it looked natural. Do you inject more fat in there, which would be the logical thing to do? You can, but now that area is really thin and it's scarred, so it's tight. You might not be able to do that well. Can you add filler in there? Maybe. Sculptra would be a great filler to add in there to kind of build up collagen, but again, it may not look natural. This is why you want to take a few minutes out of your day in your life. If you're considering things like this and you've seen this on social media and you really want to understand what's possible, consult with a board certified plastic surgeon such as myself. I mean, I want to hear from you if you've considered things like this. You can see me for consultation. You can drop a comment in the comments below, and you can book a consultation with me, and we can chop it up. I'll tell you I'll tell you what I think is good, possible, bad, shouldn't do it. And it's really easy to do. All you have to do is to do a couple of things. There are a couple of ways to get a hold of me. You can contact me by just calling me. You can call the office 770-466-4700. Set up your appointment. There is a fee for the consultation. It's $225. But again, if you're considering a snatch nose or you've had a snatch nose and you're wanting to kind of figure out what you can do about it, it's really worth your time to consult with me. And I can tell you the right direction and the best direction to get you hopefully back close to where you were before safely. Or you're thinking about having a buccal fat pad removal, or you want a fox eye, or whatever. You want a breast augmentation just to get down to back to baseline and routine things. Consult with me so that you get the information you need and you stay out of trouble. It's really simple. So you just call that number. If you're not kind of ready to call, but you want to kind of inquire, but you still want to have direct communication in a sense, you can always email the office at concierge@esjaesthetics.com. So we'll be willing to answer your questions. The team is here. I'm here. So we'll be happy to answer your questions so that you feel comfortable enough to call and make your consultation. On that note, folks, we're going to wrap it up. I really appreciate it again, you guys hanging with me. We're talking about social media trends. Not everything that glitters is gold. Just remember that. So, on that note, wherever you are in the world, I hope that you are with people who care about you, you're at peace, and I hope that your day continues to get better and your weekend is phenomenal. On that note, I'll see you back here next Saturday for another episode of Plastic Surgery Talking Advice. Peace.